Hello there, I'm Dr. Nicole Calloway Rankins. I am a board certified OB/GYN physician as well as a certified integrative health coach. I do short videos, live videos about once a week on topics to help you related to pregnancy and birth. I also have a free 1-hour online course on how to make your birth plan, as well as a more extensive childbirth education course, the birth preparation course. All right, so today I'm talking about breech presentation. And breech is just basically when your baby's bottom is closer to your vagina than your baby's head. And breech presentation is fairly common in the beginning of pregnancy because babies have a lot of room to move around. So before 28 weeks, about a quarter, 20 to 25% of babies will be breech. Once you get to 32 weeks, that number drops to about 15% or so. And by full term, only about 3 to 4% of babies are breech. Now, most of the time, breech presentation is random. We don't know why it happens, it just happens. But there are a few risk factors. If you've had a breech baby before, then that increases your chances of having a breech baby again. If there's something different about the shape of your uterus, for example, if you have fibroids that are changing the shape of your uterus, or if you were born with a uterus that's shaped differently, something like a bicornuate uterus, and you would know that ahead of time, that increases your chances of having a breech baby. Extremes of amniotic fluid. So if you have a lot of amniotic fluid and the baby has a lot of room to move around, then that can increase your chances of having a breech baby. Also, on the other side, if you have low amniotic fluid and the baby gets set in a breech position, then it's harder for the baby to move out of that position in low fluid. And then finally, the older you get, the more chance it is that you could have a breech baby. Now, how do you know if your baby is breech? Well, you may feel more pressure, like right underneath your ribs, because the head sitting under there may cause you to have more pressure. You also may feel the kicking lower down in your abdomen, like closer to your vaginal area, because the feet are down there. A doctor may pick up your baby's heart rate higher. The heart is closer to the head, so when they're checking the heart tones at your appointments, then you may notice that if the heart rate is higher, that may mean the head is higher. And then finally, on a vaginal exam, checking your cervix to see if you're dilated, it feels different if it's a breech baby than if it's a head down there. Now, breech is definitively diagnosed with ultrasound. Now, there are 3 types of breech presentation, and I'm going to see if I can share my screen here. Hold on, let me see for a second. You know what? I'm not quite. Okay, sorry. I was hoping to share my screen so I could show you what the different positions are. But there are 3 types. One is complete breech, and that's where both the hips are flexed and the knees are flexed. So the hips are bent and the knees are bent. It's kind of like the baby is like tucked, like a tucked position, okay? Then there's frank breech, where the baby's hips are flexed, but the knees are extended. So the legs are going to be like the feet are going to be up by the baby's head. That's frank breech, and that is actually the most common type of breech. That happens about 50 to 70% of the time. And then for incomplete breech, where one or both of the hips is not completely flexed, usually it ends up being a footling breech, where the feet are presenting first. Now, it's important to know which type of breech exists, because with an incomplete breech, the shoulders and the head could potentially get stuck during delivery. And I'm going to use my handy doll here. Her name is Moonlight. That's what my daughter's named her, Moonlight, to show you what I mean. So when a baby is coming head down, okay, the widest part is going across here. So if all of this fits through, then the rest of the baby is going to fit. But if a baby is coming feet down, and if my hands are like the cervix, then as the baby comes down, baby could get stuck in the cervix because the skinnier part has come through, but the wider part has not, and that is actually very dangerous. So the type of breech presentation actually matters. All right, so what happens if your baby is breech? Well, there are three options. The first option, and this is the most common thing that happens in the US, is a planned cesarean delivery. And that wasn't always the case. This recently changed in the last 20 years or so, where now the most common thing that happens is a planned cesarean delivery for breech birth. And the reason that happens is because of a trial in 2000, a research study called the Term Breech Trial. And that study showed that babies that are breech, when you look at babies that are born vaginally versus babies that are born with cesarean delivery, babies that were born by cesarean had less problems, okay? So that completely transformed the way that we managed breech babies in pregnancy, and now 95% of babies that are breech are born by cesarean delivery. Now, the second option is something called an external cephalic version. So external, we do it from the outside, and cephalic version means we're trying to turn the baby from breech to the head being down. We do it at about 37 weeks or so, and it's like a 50-50 chance of it being successful, to be honest with you. About 50 to 60% of the time, it'll be successful. We're not super duper great at turning babies around. It's also a painful procedure. It's uncomfortable to try to turn the baby around. So we often use medications to help relax the uterus. Those are called tocolytics. And also pain medication, even up to an epidural during the procedure, because it can be uncomfortable. There are also risks with an external cephalic version. There's a tiny risk. It's less than 1% of the time that this happens, and I've actually never seen it happen, but your water could break, or it could cause a placenta abruption. So, and there are a couple other risks as well, but the risks are small, less than 1% of the time, but I did want to let you know about that just so that you're fully informed. Okay, and then the last option is a planned vaginal breech delivery, and that just very rarely happens. There are few providers today who are comfortable or skilled and trained in doing vaginal breech deliveries. They tend to be older providers who knew how to do it from, back in the day kind of thing. I personally have only done one vaginal breech delivery, and I've been in practice for 12 years now. And that was because baby was coming. There was no stopping that. Baby was just going to be born breech regardless of what I did. So it's just not something that we're skilled in doing. Now, I do want to tell you what ACOG is the American College of Obstetricians and Gynecologists. They set the standards for OB care for us OB doctors and OB care in general. And their position on breech delivery is this, and I'm just going to read it. Obstetricians should offer and perform external cephalic version whenever possible. So we should offer you the option of turning a breech baby if possible and turning it to head down. And then the rest is the decision regarding the mode of delivery should depend on the experience of the healthcare provider. Cesarean delivery will be the preferred mode of delivery for most physicians because of the diminishing expertise in vaginal breech delivery. So the reality is that there are just not that many physicians who are comfortable with doing vaginal breech delivery, and you want a physician to do what they feel comfortable with and what's safest, and that in the most cases is going to be cesarean delivery. Now, I do want to say one quick final word about something called Moxie Busting, and I hope I'm saying that right. I think I am. Moxie Busting is a form of traditional Chinese medicine where an herb is burned at the edge of the little toe. And there's a little bit of evidence, a little bit of research, not a lot, that shows that Moxie Busting in combination with acupuncture can help turn a baby from breech to head down. Now, there's not an exact agreement on how much or where to do it, but it's been shown that likely if you do it twice a day between 33 and 35 weeks, then you have about a 1 in 8 chance of turning a breech baby to head down, okay? Now, if you decide that you want to pursue something like traditional Chinese medicine, be sure that you get someone who is a licensed provider in acupuncture and they have experience with caring for pregnant women. Okay, that is it on Breech Presentation. If you have any questions, then leave them in the comments and I will check and see here if I see anything. And oops, sorry about that. And oh, okay, Liz says that her baby turned transverse. Sometimes they do that, and they may go from breech to transverse to head down. So hopefully your baby will keep going and turn to head down. Okay, so if there are any other questions, then leave them in the comments, and I will be sure to answer them there, even if you ask them during the replay. Now, I do have to state a quick disclaimer that information provided is for educational purposes only, and if you have specific questions, then you need to talk to your own doctor. All right, now be sure to like and follow my Facebook page so you don't miss any future videos. And if you would like more information about pregnancy and birth, then sign up for my free newsletter. I'll send you information once a week. It's holistic, it's evidence-based, and it's free, of course. And it's all about pregnancy and birth to help you during your childbirth journey. So I wish you, oh, wait, let's see. Liz is asking another question. Let me see. Yeah, they can turn up until the very end. Now, they're most likely to be turned by, Liz's question, sorry, is when is the latest they can turn? And they are more, they can turn up until the very end, but they most likely, if they're going to turn, they're going to turn by 37 or 38 weeks. But always, just before the C-section, before anything, we should always do one last check to see if the baby has turned. And again, I hope she turns too. All right, so thank you again. I wish you a wonderful pregnancy and childbirth journey, and I will see you next time. All right, bye-bye.